Ladies and gentlemen, thank you for coming to today's news conference. The Honourable Frank Iacobucci, formerly a Justice of the Supreme Court of Canada and currently Senior Counsel at Torys LLP, will present his report, Police Encounters with People in Crisis, to Chief William Blair. Mr. Iacobucci will make a statement, after which he will present his report to Chief Blair. Chief Blair will make his statement, and they will then accept questions. Mr. Iacobucci.
Thank you, and thank you, everyone, for attending this presentation this morning. Before I begin, I'd like to introduce David Honourable, my counsel on the review, who earlier this morning presided at the lockup for media representatives. At the outset, I should mention that my report is publicly available on both the website of the review, which is tpsreview.ca, and my understanding, the website of the Toronto Police Service. The topic of my report, Police Encounters with what I refer to as people in crisis, is one that is surrounded by human tragedy and the loss of life. And at the outset, I wish to emphasize that people in crisis are our brothers, sisters, parents, and children. They are not apart from us. They are part of us. The report deals with the loss of life in situations that cry out for attention and raise the fundamental question: how can lethal outcomes be avoided without sacrificing protection of the public safety or the sanctity of human life? The impact of the loss of life is enormous, not only on family members or loved ones of the person in crisis, but also on the police officer who applied lethal force, or on other colleagues directly involved, and on bystanders who observed the events. These encounters are regrettably part of an international phenomenon that presents a fundamental challenge to police services across Canada and abroad. This morning, I'd like to take the time to discuss 5 aspects of the review and the report. First, my mandate and independence. Second, the importance of considering the various perspectives involved in addressing this complex issue. Third, the underlying role of the mental health system. Fourth, the topics I covered and the major themes of the report. And fifth, my recommendations on implementation. On August the 28th, last year, the Chief of Police, William Blair, requested that I undertake an independent review of the use of lethal force by the Toronto Police Service, with a particular focus on encounters between police and people in crisis. The report is not a comment on the conduct of any specific incident. My mandate expressly forbids me from addressing specific incidents. The basic focus of this report was to consider how, going forward, we can prevent lethal outcomes. The Toronto Police Service has done much in this area that is positive and is a leader in this subject in a number of respects. But I believe improvements can always be made, particularly as knowledge, experience, and examination of the issues increase over time. I was instructed by Chief Blair that the hallmark of my review was intended to be its independence, and the end result of the review was to be a report to be made public, setting out recommendations that will be used as a blueprint for the Toronto Police Service in dealing with this serious and difficult issue in the future. More specifically, my mandate was to conduct an independent review of the, quote, the policies, practices, and procedures of, and the services provided by the Toronto Police Service with respect to the use of lethal force or potentially lethal force, in particular in connection with encounters with persons who are or may be emotionally disturbed, mentally disturbed, or cognitively impaired. I have elected to use the term person in crisis in this report to refer to those whose behavior brings them into contact with the police, either because of an apparent need for urgent care within the mental health system or because they are otherwise experiencing a mental or emotional crisis involving behavior that is sufficiently erratic, threatening, or dangerous that the police are called in order to protect the person or those around them. The term person in crisis gives primacy to the person and focuses on their experience of a crisis in the specific moment that the police are involved, without drawing conclusions or making assumptions about the specific reasons for that experience or about their mental or emotional condition before or after the incident. More pertinently, my mandate included reviewing the following topics: Toronto Police Service's policies, procedures, and practices. There's Toronto Police Service training and training at the Ontario Police College, equipment used by the Toronto Police Service, psychological assessments and other evaluations of Toronto Police Service officers and officer candidates, supervision and oversight, the role of the mobile crisis intervention teams currently employed by the Toronto Police Service, the role of the Toronto Police Service Emergency Task Force, best practices and precedents from major police forces internationally in Canada, the United States, the United Kingdom, Australia, and other jurisdictions, available studies, data, and research, and then omnibus other related matters falling within the scope of the independent review. In the course of the review, I met with over 100 individuals who were members of the Toronto Police Service, mental health specialists, academics, representatives of stakeholder groups, counsel for participants at inquests, and experts in specialized fields. We also met with family members of individuals who have died as a result of contact with the police, who experienced psychological with the police, and individuals who've come into contact with the police while in a state of crisis. Also, we met with police officers who experienced psychological difficulties after their involvement in a traumatic incident. We visited the Toronto Police College, the Ontario Police College, the TPS Communication Services and mental health drop-ins and treatment facilities, and went on ride-alongs with the MCIT groups that have been inaugurated in 2000. And we also, some members of my team attended the Joint Canadian Association Chiefs of Police and Mental Health Commission of Canada Conference on Policing and Mental Health. I also invited input from stakeholders and the public to the review and hosted a roundtable discussion with a selection of stakeholders to discuss different points of view. Finally, my team and I reviewed more than 1,200 documents consisting of applicable legislation, various TPS reports, policies and procedures, and reports from other police services, academic literature on a variety of topics germane to the review, coroner's inquest submissions and recommendations, and training materials, among other things. To provide different independent perspectives, I invited 3 distinguished individuals to be my advisory group: Dr. John Bradford, an eminent forensic psychiatrist, Paul Copeland, a leading criminal lawyer, and Norman Inkster, a widely respected former commissioner of the Royal Canadian Mounted Police. Now, I wish to emphasize that the premise of the report is the target should be 0 deaths when police interact with a member of the public. No death of the subject, no death of the police officer involved, or of any member of the public. I believe the death of a fellow human being in these encounters is a failure for which blame in many situations cannot be assigned. And in these cases, it's more likely the failure of a system. Policies and procedures should be designed and exercised with the 0 target in mind, but, of course, not at the cost of ignoring the safety of the subject, the police, or the public. In looking at this question, it's critically important not to ignore the fundamental differences in three perspectives that exist in police encounters. I have sought, as best I can, to understand what is likely to be the police officer, or to be what is it like to be the police officer, or secondly, the person in crisis, in the highly charged moment of a potentially violent encounter, or thirdly, what is it like to be one of those directly affected by the death resulting in an encounter. Without that perspective, one cannot fully appreciate what causes fatal encounters or be well situated to try to prevent them. I would like to spend a few minutes to discuss briefly some of the points arising from this trilogy of perspectives that inform the report. First, the perspective of the police officer. Encounters in which police use lethal force against a person in crisis often take place in the space of seconds, in a rush of emotion, adrenaline, and fear. Those who review such encounters after the fact, on the other hand, have the benefit of time, information, detachment, and hindsight. I strongly believe, based on my personal observations and abundant secondary evidence, that most frontline police officers within the Toronto Police Service have a genuine desire to fulfill their mandate of serving and protecting the community, and a genuine desire to avoid causing harm. They have a strong sense of duty. Certainly no officer begins his or her daily shift with wanting to cause serious injury or death, or wanting to be involved in a dangerous encounter. If they can avoid causing harm, police officers would like to do so. It is, in fact, the existence of this pervasive desire of the Toronto Police Service personnel to do good that inspires me in the confidence that my report will produce positive results. Police are entrusted with the weighty responsibility to use lethal force if necessary, and they are under tremendous pressure to carry out that responsibility with honor and integrity, without error. At the same time, frontline officers are confronted regularly with threats and potential threats to their personal safety that inevitably cause them to be afraid, and therefore to experience a very strong and natural urge to protect themselves. The perception of being in potential danger is ever present for the frontline officer, far more so than for the average member of the public. It is understandable that officers may feel impelled to try to control dangerous situations quickly. Now, I go to the perspective of the person in crisis. The person in crisis has a very different perspective on an encounter with the police. The person in crisis does not come from a position of power and responsibility, and does not enter the encounter with the imperative of achieving control and resolution. By definition, the person in crisis is not immediately capable of self-control, let alone control of the situation. Above all, the person in crisis needs help. Whether it is by reason of mental illness or a more transient mental or emotional crisis, possibly induced or exacerbated by drugs or alcohol, the person is in anguish. The person's crisis may manifest itself in belligerent behavior, making it more challenging to receive help. In fact, it may well be that the person in crisis poses such an imminent and serious danger that it is essential that the police immediately contain the person or immediately use force to subdue the person. The person may also be experiencing delusions that make it difficult or impossible to understand what is real. The person's need for help makes an encounter with the police, in one sense, desirable, because the police have the mandate to serve and protect those in need. When analyzing how to prevent deaths in such encounters, one must focus on how to prevent either the crisis itself or the encounter with the police from occurring in the first place, which involves improving the mental health system, among other things. One must also look at methods and means of containing or subduing the person without lethal force. which involves looking at tactics and equipment. In that connection, the importance of de-escalation cannot be overemphasized. A failure to de-escalate can arise from a number of causes, including lack of understanding by police regarding the level of risk posed by the person in crisis, or a lack of knowledge or ability on how to de-escalate effectively. While it is clear that the Toronto Police Service devotes considerable effort to educate its members on proper risk assessment and to train them on effective de-escalation techniques, it is also clear that education and training are not 100% effective. There have been encounters between the Toronto Police Service and people in crisis in which there has been a failure to de-escalate. In this second category of failed encounter, when the person in crisis, what the person in crisis needs is empathy, patience, guidance, and help. Some people in crisis carry weapons, and necessarily because they wish to be aggressive, not necessarily because they wish to be aggressive, but because they feel a need to protect themselves from real or perceived threats. When police arrive, what many people in crisis most need is reassurance. The person in crisis also views the treatment they receive by police as an issue of fairness. Many people in crisis suffer from mental illness, which makes them different from others in ways they cannot necessarily control. Their difference deserves accommodation within reasonable limits. The person in crisis does not want to be treated as an object, but as a fellow human being. Now for the perspective of those directly affected by a death, the third perspective. It is a perspective that has had a profound effect on my appreciation of the issues in this report. It is the perspective of those directly affected by a lethal encounter, who live on after the death and are permanently scarred by it. This group of people includes not only the family of the person killed, but also the officer who caused the death and the officer's family. When a person in crisis is killed by the police, it has a terrible effect on the deceased person's family. In addition to the heartbreak of the loss itself, family members then often experience a tremendous sense of guilt. Guilt that they could not protect their parent, siblings, spouse, or child from death, and guilt that they were unable to provide the person with access to necessary treatment. Guilt is often accompanied by blame, which may be directed outward at the police and the mental health system, or inward at other family members. Families can be destroyed, as can their faith in some of the central institutions of our society. What is often not appreciated is the effect of police killings on the officers themselves. Causing the death of a person who needs help is a police officer's nightmare. Regardless of how justifiable the killing may have been in terms of being necessary in order to protect the life of the officer or others, the officer experiences self-doubt and guilt, which is exacerbated to a very high degree by the ensuing SIU, Special Investigations Unit investigation, media scrutiny, and an inquest, as well as any legal proceedings that may follow. The mental health of the officer is placed in significant jeopardy, both in the immediate and longer term. The officer's family suffers alongside with a feeling of helplessness as the officer goes through all of the painful stages of trying to heal. When the issues are looked at from these perspectives, the importance of seeking to prevent lethal encounters between police and people in crisis becomes crystal clear. If reasonable steps can be taken to prevent even one unnecessary death, then those steps must be taken. Now to the mental health system. The report takes a holistic approach to the mandate that was given to me. It is clear that the police are part of the mental health system. They have become the frontline mental health workers for many of the most dangerous encounters. Preventing deaths includes preventing the crises in the first place, as well as helping police to deal with these crises better. One of the key themes of the report is the need for interdisciplinary cooperation, learning, and teaching, involving not only police and mental health professionals, but also mental health consumer survivors. It is their lives and deaths that are at issue, and they should not be treated as the problem being discussed. They are our fellow citizens and should be encouraged to work with us to find solutions. However, the mental health system is a huge issue that warrants further elaboration. One cannot properly deal with the subject of police encounters with people in crisis and not consider the availability of access to mental health and other services that can play a role in the tragic outcomes for people in crisis encounters with the police. Police officers, because of their 24/7 availability and experience in dealing with human conflict and disturbances, are inexorably drawn into mental and emotional fields involving individuals with personal crises. This suggestion about the mental health system is not intended as a comment or a reflection on the individuals working in mental health in Ontario, many of whom are leaders in their field. It is a comment on the overall funding and coordination of mental health care in the province, which does not function as a comprehensive system of care. There will not be great improvements with police encounters with people in crisis without the participation of agencies and institutions of municipal, provincial, and federal governments, because simply put, they are part of the problem and need to be involved in the solution. In many ways, I have found, to be candid, this reality the most distressing societal aspect of my work on the report. The effective functioning of the mental health system is essential as a means of preventing people from finding themselves in crisis in the first place. There is not much I can do through my recommendations to remedy the applicable problems in the mental health system, since I can recommend changes only to the Toronto Police Service. But the basic and glaring fact is that the TPS alone cannot provide a complete answer to lethal outcomes involving people in crisis. Now, the report addresses the following 9 topics. First, the mental health system and the Toronto Police Service. I underscore the reliance placed on the Toronto Police Service as part of that system to deal with people in crisis and the numerous issues that arise. Second, I discuss the centrality of police culture with its positive and negative features. And I highlight a key theme of this report, the strong influence that the culture of the Toronto Police Service has over individual officers' actions. And by culture, I mean the prevailing attitudes, beliefs, and values of the service. Ultimately, in one sense, the issues that are addressed in the report all have to deal with police culture, because my recommendations aim to affect behavior, and meaningful change to behavior involves assisting in the evolution of attitudes, beliefs, and values that guide behavior. Third, I address the process for selection of new recruits by the Toronto Police Service for appointments to specialized roles within the TPS and the relationship of these issues to encounters by the Toronto Police Service with people in crisis. The role that police psychologists play in these processes is an important issue, and the educational and other factors for new recruits also merit further consideration and comment. Fourth, I discuss training, both for recruits and in-service officers, and the role training plays in police encounters with people in crisis. Though training is an important influence on an officer's actions, it is not the only influence. The Toronto Police Service has focused a lot of attention on training in recent years, and other aspects of the service, such as culture and supervision, are equally, if not more, important in implementing the training that is already taught. And fifth, this also brings me to the supervision of officers, which is critical in ensuring that training is translated into practice. I discuss mechanisms which may help ensure this takes place. Leadership at all levels of the service is of central importance in ensuring that officers' performance meets best practices. Sixth, I look at and suggest improvements to the institutional mechanisms that the TPS has in place to address the mental health of police officers themselves. In a crisis situation, it is important that officers be psychologically fit in order to provide help to others. Seventh, I analyzed the TPS use of force policies and practices which are of critical importance in the handling of police encounters and merit further consideration in the context of a person in crisis. Eighth, I discussed the mobile crisis intervention teams and various other crisis intervention team models that police services have employed to better handle police encounters with people in crisis, and I suggest ways in which the TPS may be better able to provide a specialized response to people in crisis. Ninth, I examined the different types of equipment used by the TPS in encounters, the utility and concerns regarding the use of conducted energy weapons, and the need for the use of weapons to be highly regulated, recorded, and studied. Now, from these topics, these 9 topics, there are a number of themes that emerge. First, the recommendations in this report, I believe, cover all the topics in the mandate I was given. Second, the recommendations seek to achieve a balance between using the minimal force required in the circumstances while acknowledging the police officer is exercising judgment in a situation of great pressure and stress. Third, the importance of de-escalation in police encounters, as I said earlier, cannot be overemphasized, nor can the importance of protecting the lives and safety of everyone. Fourth, the recommendations are many and raise resource issues that may prove to be difficult. But one cannot ignore what is at stake is a human life, as well as the treatment of a vulnerable group in our society. Fifth, some recommendations involve further study. For example, regarding the possible harm effects of using conducted energy weapons or the introduction of a pilot project. Sixth, although recommendations are directed that the Toronto Police Service, other parties or institutions implicitly are urged to be more involved. For example, the Ministry of Health and Long-Term Care of the province. Seventh, increased evaluation and monitoring are encouraged to continue the search for improvements. Finally, I've attempted to make recommendations that are practical. Now, on implementation, an important subject, to address this subject, I come to the 84 major recommendations that are in the report. I strongly recommend the setting up of an advisory committee on implementation that would include representatives of stakeholder groups. And the advisory committee would provide advice to the Chief of Police for his consideration. The TPS has already been receptive to stakeholder input, so this should not prove to be controversial. Obviously, senior Toronto Police Service personnel should also participate in the advisory committee, and to ensure accountability. After deliberations by the committee, ultimately, the chief can explain publicly the status of implementation and the reasons for the implementation decisions that were taken. To ensure the efficacy and accountability of the implementation process, I've also made a number of other recommendations regarding implementation that I've set out in the report. Let me just conclude. I would be remiss if I did not commend the Chief of Police, the Toronto Police Service, and the many other stakeholders, including those with lived experience of mental illness, for their efforts that they have made to achieve progress in this area. Collectively, they have not assumed that the status quo is as good as it's going to get and is therefore good enough. And I have to note that the Chief Blair and the TPS did not have to call for an independent review. The effect of calling such a review is to take some degree of control away from the Toronto Police Service over change within the organization. Not only did the Toronto Police Service do that, but it also agreed in advance that the report and recommendations emanating from the review were to be made public, and without knowing, of course, what those results or recommendations would be. For those killed and for their families, nothing can take away their loss. For people in crisis who've had negative experiences with police, self-evaluation by the police and the larger mental health field is meaningful if there is real change. Recognizing the TPS for taking this initiative is important, but the real work remains to be done. And the true test of the Toronto Police Service and those organizations with which the Toronto Police Service interacts will be what changes they make and the approach they take to the task. What they do in this area is fundamentally important to reinforcing public trust and confidence in the Toronto Police Service. Now, as is customary, I have provided a digital copy of the report earlier to Chief Blair, but I would now like formally to give him a copy of my report.
Thank you, Justice. And thank you, ladies and gentlemen, for joining us here this morning. There is no greater challenge facing the police service in Toronto and police services across Ontario and across Canada and perhaps around the world than dealing safely and appropriately with persons in crisis. When tragedies occur, I have a statutory responsibility to ensure that we look at every manner in which we deliver services, our policies, our procedures, the training that our officers receive, the direction that they receive from this organization, the equipment that they use, and to do everything within our power to ensure that we remain committed to continuous improvement, to finding better ways to deliver those services and to keep people safe so that we might fulfill our mandate to serve and protect the people of Toronto. Last August, in response to yet another incident with tragic consequences, I reached out to Justice Iacobucci. Justice Iacobucci, who has an extraordinary record of public service, of demonstrated wisdom, and a commitment to making a difference. I believe that he was the credible individual and the team that he has assembled in order to examine this issue and to make recommendations to our police service and to our partners in the mental health system that will truly make a difference. I want to take this opportunity now to thank and commend Justice Iacobucci and the team that he has assembled. They have done an extraordinary public service. They have done a service in their recommendations to the Toronto Police Service, and they have done a service to all of the people of our city, our province, and our country, in giving us a roadmap, a very clear sense of direction on how we can move forward and how we can make real change that will affect the lives and the outcomes of these very challenging encounters. I want to acknowledge that work, and by telling you all, this is not a report that will gather dust. This is a report that will gather momentum. This is a report that contains 84 recommendations that I believe are excellent recommendations. And I am committed, and the Toronto Police Service is committed to moving forward as quickly as possible in their implementation. Now, as Justice Iacobucci has acknowledged in his report, we are part of a system. We are an important component working in partnership with many parts of our society in dealing with issues around people who are suffering mental illness or persons in crisis. And we are committed to working in partnership as we move forward together to take a collaborative and cooperative approach with our partners to make a real difference. We will move on the 84 recommendations made by Justice Iacobucci and his team with a strong sense of urgency and resolve. I believe that these recommendations provide us with a clear sense of direction. This report has been comprehensive. It has been objective. It has involved a broad consultation, and I want to take the opportunity to acknowledge and thank the more than 100 individuals and organizations that met with the Justice in order to provide their input. I believe their participation demonstrates our shared commitment to doing the best possible for all of the individuals who are suffering mental health issues or are people in crisis. To that end, I believe that there are some things that we can do immediately. One of the most important recommendations contained in Justice Iacobucci's report is consistent with our long-standing commitment to a collaborative and consultative approach with our community partners, was the formation of an implementation advisory committee. We have taken this particular recommendation to great heart and believe that by its immediate implementation, we can start the important work of implementing the other 84 recommendations. The advisory committee, as Justice Iacobucci has recommended, should include members of key stakeholder groups, including hospitals, community mental health organizations, the police, and those with the lived experience of mental illness. And I'm very pleased today to be able to announce to you that we have reached out to the following individuals and organizations and asked them to participate, and I am very gratified by the positive response that we have received from them, which demonstrates their commitment to working with us to make a difference. And included among the people that we have reached out to date include Ms. Susan Davis, the Executive Director of the Gerstein Center, which provides crisis intervention and supportive counseling to adults living in the City of Toronto who experience mental health problems. We've included Dr. Catherine Zahn, who is the President and CEO for the Center of Addiction and Mental Health, Dr. David Goldblum, who is the Chair of the Mental Health Commission of Canada and Senior Medical Advisor at CAMH, Ms. Pat Capone, who joins us here today, who is the lead facilitator of Voices from the Street, an important voice and a long-standing partner of the Toronto Police Service, Ms. Jennifer Chambers, the coordinator of the Empowerment Council, also a strong and powerful voice consisting of people who have received mental health and addiction services, Mr. Steve Lurie, the Executive Director of the Canadian Mental Health Association here in Toronto, Ms. Abby Deschman, who is the Director of Public Safety Program of the Canadian Civil Liberties Association, a national organization promoting respect and observance of fundamental human rights and civil liberties, Mr. Bruce Herridge, who is the Director of the Ontario Police College, responsible for the training of all police recruits in Ontario, as well as our partners in the 16 emergency psychiatric facilities here in Toronto. We believe that the formation of this advisory committee will be an important first step in moving forward on these additional recommendations. As well, at recommendation 78 in the report, Justice Iacobucci has encouraged me to assign a senior executive level lead for the implementation of these recommendations within the Toronto Police Service. And to this end, I am announcing today that Deputy Mike Federico, who is standing behind me, will be the executive lead. And I want to be very clear. I am not abrogating my responsibilities as the Chief of the Toronto Police Service, but the importance of these recommendations requires a committed individual who can give their focused and unrelenting attention to the important development and implementation of these issues. Deputy Federico has assembled a dedicated team within the Toronto Police Service, which will include a superintendent who is currently in charge of our MCIT support, a number of staff sergeants and planners, civilian members, and others who oversee government partnerships and who provide services. Deputy Federico is also representative on our board's mental health subcommittee, and I also want to acknowledge Dr. Mukherjee, who is the chair of our police services board, and acknowledge the important role of the board in the implementation of these recommendations as well. I'll speak a little bit more to that in the future, but I have asked Deputy Federico to take this on to ensure that this organization doesn't take its eye off the ball. This is not a report, as I've said, that can gather dust. This is a report that we are committed to moving forward on. And finally, I would also like to acknowledge a recommendation, number 5, made by Justice Iacobucci. And he spoke earlier in his remarks, and he speaks quite eloquently and comprehensively in his report about the importance of attitude, beliefs, and values. And he encourages us, and he encourages me on behalf of the Toronto Police Service to make a strong statement of commitment of those values and what we stand for and what we believe in. And I am prepared to do that now. As members of the Toronto Police Service, we have all made a commitment to serve and protect the people of Toronto. It is the motto of our service, but it is much more than that. When we answer the call to duty, this is the duty of which we speak. This is the duty that has defined our organization and which has guided our collective and individual efforts for generations of service and of sacrifice. Police officers have many duties. We are responsible for upholding the law, preserving the peace, preventing crime, and assisting victims. But among our many responsibilities, our highest duty is to preserve the lives of the citizens that we have sworn to serve and protect. It is a commitment made by every member of our service. Whenever danger threatens, it is the duty of police officers to move towards that danger, to place ourselves between the threat and the people we protect, to do everything reasonably within our power to protect the vulnerable and to preserve life. Among the most vulnerable people in our society are those that are experiencing mental health issues, requiring urgent care, or because they are otherwise experiencing mental health or emotional crisis involving behavior that is sufficiently erratic, threatening, or dangerous that the police are called in order to protect the person in crisis or those around them. Responding to situations involving persons in crisis is one of the most challenging responsibilities that we have been given, and the safe resolution of such events requires our shared commitment to certain values and principles. And to that end, we make the following commitments to the people of Toronto related to people in crisis, and more broadly related to people experiencing mental health issues. Members of the Toronto Police Service are committed to preserving the lives of people in crisis wherever reasonably possible. Our goal is the safety of every citizen, and we aspire to preserve every life. In every encounter with a person of crisis, we are committed to taking all reasonable steps to attempt to de-escalate a potentially violent encounter and to safely resolve such situations. Recognizing the increasing complexity of responding to persons in crisis and the role that we have been given in the mental health system, we remain committed to continuous self-improvement and innovation in both policing and in mental health. We are committed to the elimination of stereotypes and the stigmatization that victimizes persons experiencing mental health issues through education of both our members and of the public. We remain committed to involving people with mental health issues directly where appropriate in initiatives which affect them, including training and the development of relevant police procedures. We will continue to work collaboratively with our partners in the mental health system, including individuals, community organizations, mental health organizations, and hospitals. We are committed to institutional leadership in matters of policing and mental health, and we will strive to become preeminent police services in this field. And finally, we are committed to fostering and maintaining a positive mental health culture within the Toronto Police Service. I want to conclude my remarks by again expressing my very sincere gratitude to Justice Iacobucci and the team that he has assembled to help him, and to all of the members of our community who met with the Justice and have helped in the compilation of this report. I believe that the 84 recommendations that the Justice has provided the Toronto Police Service today provide us with a clear direction to go forward. And I believe in the implementation of those recommendations, we will be able to improve the quality of our response, the support and the direction that we provide to our members. As the Chief of the Toronto Police, I have a responsibility. First of all, I have a responsibility to all of my members to ensure that we provide them with the best direction, the best training, and the best support to do the most difficult and challenging responsibilities of a police service. I have a responsibility to the people of Toronto to ensure that we provide the best service, that we live up to our motto and our mission to serve and protect all of the people in Toronto, and in particularly those most vulnerable people in our society, which includes those who are suffering mental health issues. We do not believe that the status quo is good enough. We believe that we together, working together, can make a difference. And we believe these recommendations clearly give us a direction and advice as a result of a very comprehensive review of all of the issues. I also want to acknowledge that there is a great compassion threaded throughout Justice Iacobucci's work. And that compassion should also inform us and help us establish our values in response to the people who are suffering mental health crisis and who need our help more than anyone else in society. We're committed to making a difference. And I want to express that commitment on behalf of all of the members of the Toronto Police Service. We will move forward on these recommendations, and together, working with our partners in the mental health system, we will make a difference. And I also want to assure you all that we will be transparent in the way in which we move forward on these recommendations. I have a responsibility to my Police Services Board, and I met with my chair this morning. The statement that I read to you today is a statement of commitment on behalf of all of the members of the people of Toronto, but it's a statement that should be enshrined in our services history and our goals through policy. And that statement will be reflected in policy as a result of work that we will do with our board. And I also have a responsibility to routinely and regularly report to my board in a public forum on the progress that we are making in the implementation of these recommendations. We will make a difference together. Thank you very much, Justice.
Ladies and gentlemen,